Good morning to everyone. Most of you know that I regularly have senior fairs, and because of COVID-19 right now, we're not able to do that. So we're looking for ways to bring information to you, especially on COVID-19 and what's going on right now with COVID-19 in the healthcare sphere. And we have people who are here to talk to you about that today. Also talk about some of the government services, and obviously everything has changed because of precautions that need to be taken. So we have a couple people here who are going to talk to you about how those services have changed and what services are still available. But I know this is a tough time for all of us, and I think especially for seniors, because of the concerns over the COVID-19 virus and those who are more susceptible to having more severe cases of COVID-19. I'm a type 1 diabetic, so it's something that I'm very familiar with, and I have been very careful in what I have been doing to try to avoid the virus. So there are things that we all can do to keep ourselves safe, and we're going to get some advice on that and what sort of the latest healthcare advice there is on keeping yourself safe from the safest you can from the coronavirus. So that's what we're here for today. And so hopefully you do find this helpful. If things do get to a point where we can feel safe having senior fairs, we will do that. We will certainly let you know that those are taking place. So one thing I wanted to talk about a little bit before we get to our experts here today, we did pass a couple of bills in Congress that are going to fund coronavirus testing and research, provide assistance to help try to stabilize the economy, provide direct financial assistance payments to people, and these have gone through. And there are a few things that are specific to seniors that I wanted to highlight. Well, first of all, one thing that we included in this legislation is ensuring that COVID-19 testing is free for everyone who's on Medicare and also who has private insurance. So the testing is free, and once there is an approved vaccine for COVID-19, that will be available free also to everyone who is on Medicare or who has other private insurance. So just to make sure, you know that the testing is free, and also that the vaccine will be free when it's available. In the legislation we passed on Medicare, you can now get a 90-day supply of medication, so that it's not limited to a 30-day supply or lesser than 90 days, just to make sure you have your medicine. Additional funding was provided for senior nutrition programs like Meals on Wheels and other programs that provide meals in group settings. Doctors are allowed now to perform telehealth services more easily under Medicare, so that there are services that you can receive from your doctor in Medicare that you do not have to go into the office. So those are some of the things that we have done. Also, there's a economic impact check of up to $1,200 for individuals earning less than $75,000 a year, up to $2,400 for married couples earning less than $150,000 a year. And checks were to be automatically sent to Social Security recipients who don't have to file taxes. Now, I know there's been some issues with that, and as always, any questions that you have, any issues that you have, My office is still open. Offices are still open and available. Any issues you have with having gotten that check, or if you have other Medicare, Social Security questions, questions on unemployment, other benefits, VA benefits, please do reach out to us, and happy to help. And leading the way, as always, on this, a man that many of you know, and about 2 months ago was featured by Phil Cadner in the Chicago Sun-Times for all the great work that he's done in working for me, working for my father before me, the best caseworker in any congressional office in the country. And turn it over to him, Mr. Jerry Mobil. Jerry, take it away.
Good morning. It's a pleasure to be here this morning. For the past 33 years, I've been doing congressional inquiries on Social Security, Medicare, Medicaid, the expanded Medicaid program, and also Social Security disability. I've also handled a number of senior issues, which range from just about anything. And if anybody should need help, feel free to reach me. I've been quite busy lately. We'll get back to everybody. Keep trying. Our number is 773-948-6223. And it's always a pleasure to help. And I'll be available for congressional inquiry on any of these issues. Thank you very much.
Thank you, Jerry, and thank you, Congressman, as well. During today's discussion, we're going to hear from representatives from state and local government and the public health and healthcare sectors to get current information and updates related to COVID-19. We have a great lineup of 5 speakers today from the Illinois Department on Aging, Office of the Illinois Secretary of State, Cook County Department of Public Health, Will County Health Department, and University of Chicago Medicine. First, I'd like to welcome Ms. Paula Basta, who's the Director of the Illinois Department on Aging. As Director, Ms. Basta works to coordinate services for seniors that are delivered through Illinois' 13 area agencies on aging. These services include adult day services, senior nutrition programs, community care programs, care coordination services, and many other important programs to support seniors. Director Basta will share with us the status of her agency's critical work to support seniors during the COVID-19 pandemic. Thank you for being here, Director Basta. I'm going to go ahead and turn it over to you.
Great, thank you. Great, thank you. Thank you so much. And thank you, Congressman Lipinski and Jerry and his office for all the hard work that we are all doing during these very unprecedented times. I appreciate the opportunity to speak this morning to all of our listeners out there. And I just want to say that the Illinois Department on Aging's primary concern is always the health, safety, and welfare of our older population. And I just want to make sure that our seniors know that they are not alone. The Illinois Department on Aging and our 13 area agencies on aging are working around the clock to ensure that services are provided, specifically our in-home services and our home delivered meals program. None of this was interrupted during the pandemic. The bottom line is we have been supplying over to all of our providers with more dollars, and I think that the Congressman has also talked about this through the CARES Act, which was able to give our nutrition services many more dollars to go and help seniors that they stayed at home through home delivered meals program. And so to that end, since March 30th, over 600,000 meals have been delivered to seniors' homes throughout the state. And we anticipate that the need and the demand for home delivered meals is going to continue to increase, though, as we know that people are staying home. Hopefully, though, as Illinois starts to next week go into phase 4, some of that will change. I do want to give a couple of phone numbers, though, to folks that are listening that might want to have some numbers that just locally might be able to help. So for Chicago, if you're living in Chicago, you can reach out to the Chicago Department of Family and Support Services for services for seniors. That number is 312-744-4016. Again, 312-744-4016. That's if you live in the city of Chicago. If you are in Cook County, but not in Chicago, but are in the suburban area in Cook County, you can call and reach out to Age Options. Age Options phone number is 1-800-699-9043, 1-800-699-9043. If some of your listeners are in DuPage and Will County, you can contact Age Guide. That is the area agency on aging in your area, Age Guide. And that number again for Will County and DuPage County, 1-800-528-2000, 1-800-528-2000. I just want to make sure that people have phone numbers that are handy, because we want you to know that we are out there to help you, and we are here for you. I can also give you the Illinois Department on Aging Senior Helpline, and that's for general services as well. And our senior helpline is 1-800-252-8966, 1-800-252-8966. And for those of you who are out there on your computers and want to go to our website, which I think would be wonderful too, we have a wealth of information and updates on our website. Our website is www.illinois.gov/aging. www.illinois.gov/aging. Again, I want to highlight a couple of different things that we've been doing since the pandemic. And I wanted to also talk and highlight about the senior shopping hours, which has basically been happening since the beginning of March. Also, waived delivery fees from pharmacy chains have been happening. So we all know that we need to take precautions so that we stay healthy and we stay safe throughout the pandemic. And so to ensure those things, I want to encourage older adults to have their groceries delivered to them or have someone else do their shopping if possible. I basically applaud the idea of all senior stores that are having senior hours at grocery stores, which are meant to provide a safer environment for those older customers who like to go to the store and pick out their groceries themselves. Older consumers on a fixed income or have underlying health conditions should not need one more thing to be worried about when it's time to go to the store to purchase your essential supplies. So these shopping hours are convenient for you to go, and make sure that you go when they're available to you. So similarly, we encourage our older adults to have your prescriptions delivered to your home if possible. CVS, Walgreens, they are waiving delivery fees for prescription drugs. And we want to, again, make sure that people are staying home whenever possible so that you don't have to go out during the coronavirus outbreak. Again, if you need to know more information about the coronavirus, you can go to our website, and we have a ton of information on there. Obviously, and I'm so glad my counterparts at the Department of Public Health are on the call today, because obviously if you're feeling sick, please call your doctor first. Make sure that you talk to your primary practitioner, a nurse hotline. I hope they'll talk more about telehealth, which is another new thing that we have, but it's very, very important that you access your primary care physician and tell them if you're not feeling well. Please stay home and make sure you follow guidelines that your physician is telling you. So I just also want to thank you for making sure that the voice of public health is heard here today, because it's very important. They are such an important partner of ours. And we are so grateful for all the work that our first responders are doing, and all the people that are on the front lines at our hospitals and nursing homes. We are so thankful for all of our essential workers. Many of them are our in-home workers as well, who are going into the homes of our seniors, who are helping with grocery shopping and cleaning and all the things that help keep people in their own homes. And thanks to Governor Pritzker, the Illinois launched a new remote patient monitoring program, which is utilizing the telehealth services and the pandemic health worker programs, partnering with Advocate Healthcare, Southern Illinois University, and the OSF Healthcare. The programs will help reduce barriers to health and mental health services. Public health workers will digitally connect with members in their community who are experiencing COVID-19 symptoms and need to stay home to quarantine themselves to protect others as well as yourselves. Basically, a person is eligible for that program if he or she is showing COVID-19 symptoms or is at high risk for contracting the virus. A person must call the COVID-19 hotline for a final determination of eligibility for the Pandemic Health Worker Program. I'm going to give you that number now, and it's really through the Illinois Department of Public Health, and it's their COVID-19 hotline. That number is 1-800-889-3931. 1-800-889-3931. Those of you who also are able to get online and would like to send an email, you can do that at the email address dph.sick@illinois.gov. That's dph.sick@illinois.gov if you would like to send an email. For those folks that are Chicago residents and who need to talk to someone from the Chicago Department of Public Health, their phone number is 312-646-4835. 312-746-4835, Monday through Friday during business hours. Obviously, if this is an emergency during evenings, weekends, holidays, you can also call 311. Again, these resources are available for anyone in the state, and it doesn't matter what sort of insurance you have. The last point I want to talk about is social isolation, because as we all know, disproportionately, social isolation affects our older adults and those with disabilities. The stress on everybody is growing every day, so you need to plan for what you can and focus on the things you can control. I would like to encourage healthy adults to find creative ways in the form of non-face-to-face contact. We want to communicate with our older adults during this time and monitor our older family members, our friends, our neighbors, people as we practice social distancing. That continues to be one of the pillars of how it is that we will stay safe, keeping our masks on and practicing social distancing. We also know that everyone who cares about our older adults shows genuine interest. We want to share positive views, bring up stories, make sure that we're reaching out to people, make sure that we're giving them a call every single day. There are opportunities on our website and other opportunities on the area agencies on aging that I gave you phone numbers for earlier today. Age Guide, Age Options, the City of Chicago. There's a lot of things that are going now online, virtual. And so I basically, again, would love to make sure that you visit our website because those resources are there. Again, our website is www.illinois.gov/aging. And we also have set up throughout the different area agencies on aging telephone reassurance programs through many of the area agencies. So for those of you who are not necessarily tech savvy or have access to a computer, there is always the telephone. The other thing we want to talk about is the stress of social isolation that many vulnerable older adults are basically feeling. We need to make sure that family members and neighbors now more than ever report if they see a suspicious activities like adult protective services or elder abuse. Victims of abuse and neglect may not now be able to call for help because they are not alone and are more likely to be overheard. No one should have to go alone through these times. If you believe that you or anyone you know is a victim of abuse, neglect, or financial exploitation, or if you suspect someone is a victim, please call our statewide hotline, our 24-hour abuse hotline, our Adult Protective Services hotline. That number is 866-800-1409. Again, 24-hour abuse hotline for older adults and persons with disabilities. If they believe they are a victim of neglect, abuse, neglect, and exploitation, financial exploitation, of course, is 866-800-1409. All calls and the information related to older adult abuse are strictly confidential. One of the other things that we unfortunately have to think about, though, are scams. And we have seen, unfortunately, a whole new rash of scammers out there who are calling people, who are targeting our seniors. And I basically just read a story last week in Malkina about a family being a victim of a dog scam. The pandemic presented the family with an opportunity to train a new puppy at home. And yet it turns out that the people the family was dealing with were less than straightforward. People, unfortunately, are taking advantage of our older adults through these scams. Please be wary of companies offering discounts for PPE, other kinds of discounts for any kind of other things COVID related. Furthermore, if any senior gets a call purporting to be from the Social Security office and claiming there's a problem with your Social Security account, or talking to you about, as the Congressman talked about, the stimulus check that you all are receiving, please just hang up. These people are not reputable. There is no way that they're going to Social Security office is going to be calling you. So it's so great that Jerry is on from the Congressman's office, and he would also be willing, I'm sure, to help you all with trying to troubleshoot if there is a problem with your stimulus check. If someone requests any of these things over the phone, they are scammers. So please, please be suspicious of these products and do not give them any information over the phone. I just also want to make sure that you again know that there is an Attorney General Consumer Fraud Hotline, and please take advantage of that if you do feel that you have been a victim of consumer fraud. And that number is 1-800-386-5438. 1-800-386-5438. Again, just to say that we are out there for you. We are doing many, many things. To give you a snapshot, that the Older Americans Act has services throughout the state, has helped over close to 500,000 individuals last year. Our community care program, our CCP program, which is our in-home provider service, is out there working with 115,000 seniors throughout the state. Our ombudsman program, which is for our long-term care people, the folks who are in the nursing homes. We have ombudsmen who are out there in nursing homes. They are not able to visit right now, but they're doing outdoor visits, and they are your advocates. We do those complaints, we do those concerns. Please give us a call. Again, our senior health insurance program, which I'm sure Jerry knows a lot about, our SHIP program, has helped over 104,000 seniors with trying to go through and figure out what kind of Medicare coverage you would like to get or receive. So basically, I would just want to make sure that you know we are out there. The one thing I did also want to highlight, because it's been a concern, is tax season. We know we're getting a lot of calls about seniors who are looking to get their taxes done. I'm going to give you the number of the Irs Locator Tool, and that's from the IRS. And again, if you need to get your taxes done, if you call this number and you let them know where you live, hopefully they can give you the closest location or guide you through whatever they can help you with in doing it online or virtually. That number is 1-800-906-9887, 1-800-806-9887. Well, I'm going to wrap this up for now, but I'm also available for questions and any kind of comments. Again, I so appreciate the Congressman reaching out to us. I just want to make sure that people know that we are here to help. Thank you. Thank you.
Director Basta, thank you so much for your remarks and all that information you just provided. Just wanted to make sure you did mention a number of phone numbers there, and is the Department of Aging's website the best place where we can find those numbers as well, in case we didn't happen to be writing those down?
Yes, absolutely. And I apologize. It's a lot of numbers. I agree with you. Yes, everything is on our website. The one that's probably not necessarily on the website of ours is the IRS, but that website is www.irs.gov. And so I would go ahead and use that website for specifically around taxes and tax returns.
Okay, that sounds great. And I know the Congressman's office is also happy to help get the word out there about those phone numbers as well, so that we can help people connect with the services they need. Director Basta, thank you again for being here and offering those remarks.
Thank you.
Next, we're going to hear from Ms. Sue Olenek, the Executive Director of the Will County Health Department. Ms. Olenek is going to share updates on how her agency is working to keep seniors and all residents safe as Illinois continues to reopen, and any perspectives the county has on recent COVID-19 developments. In her role, Ms. Olenek is responsible for directing operations of the Will County Health Department, which works to keep the county's nearly 700,000 residents healthy and offers primary care and dental health services at several facilities across the region. Before we continue, I did just want to let our viewers know, I understand that some people are experiencing some lag. If you skip back 10 seconds and actually watch on a 10-second delay, you'll probably experience fewer interruptions. So apologize for that. And with that, I'd like to turn it over to Sue.
Hello, thank you very much. And thank you, Congressman Lipinski, for this opportunity to speak to our seniors today. We really do appreciate it. I'm the Executive Director of the Will County Health Department and Community Health Center. And that is the certified local health department for all of Will County. And we're a little bit unusual in that we have a community health center as part of our agency, a federally qualified health center that has primary care, behavioral health care, dental care, and our whole agency is available for any age group. You can go to our website and see all the different programs. I'll give you that information a little bit later, but you can go to our website, find out about all of our programs. We have 3 offices within Will County. It's a fairly large county, so we have our main office in Joliet, and then we have an office in Bolingbrook, which may be closer to some of you, and then we also have one in the eastern part of the county in Monee. So as far as the response to COVID-19, local health departments are really on the front line. Our agencies do the programs typically that had to kind of kick into place for this emergency response. And by that I mean the epidemiology that we do. We have programs here at the health department that do contact tracing every day. To some of you, that's a new term, something you haven't heard before. That's something we've been doing for decades, although we've not been doing it at the rate or in the numbers that we see now. I wanted to make today's use of time best for you seniors. And so I wanted to share with you some of the things that I think would be the best information for you at this point. I'm sure most of you have the time to sit in front of the TV and look at the statistics that are on the news and in various programs. So I'm not going to go over all of those numbers. Those are changing every day, and you can get those updates daily. And we have those on our website as well. Some of the things I wanted to talk with you about is having to do with how COVID is specific to seniors. And we're finding, first of all, in Will County, kind of a different type of situation in that the number of cases we have in Will County right now, positive COVID cases, is about 6,300. More than half of those positive cases are individuals that are actually in their 30s, 40s, and 50s. So the majority of our cases are in the population in the age classes younger than what we consider seniors. So that's something I'm sure that will be studied for quite some time and try to determine what is happening there. But seniors, especially in the age classes 60s, 70s, 80s, and beyond, you may not experience the same kinds of classic symptoms that are being put out there about COVID. In other words, you probably won't experience a fever. You may not experience any respiratory distress, especially if you don't have any kind of pre-existing condition or comorbidity with any kind of lung disease, heart disease, anything like that. So you may not get shortness of breath. You may not get the fever. You might not get the bad cough. What we're seeing in seniors that presents, and later we find out is COVID, is lethargy. being very tired, being just apathetic, not wanting to do anything, depression, getting nauseous, diarrhea, not being able to stand, getting disoriented. Those kinds of things are what we're seeing in how COVID is presenting in seniors. So it's important for you to be aware of that. And certainly some of you or many of you have probably not been, going to the doctor regularly unless you really need to go for that visit. But if you get any of these symptoms, please, don't dismiss them as, just being tired or just being out of sorts. It may very well be COVID-19. One of the things that I think is important for seniors to do as well is to develop a care plan. And I would suggest you develop this care plan with maybe your spouse or somebody else that you are trusting your health care with. There's a fillable care plan on the CDC website, and it actually gives you a place to put down all the information about what health conditions you have, what medications you're on, who your providers are. And that's a good idea to do anyway. That's a good thing to have in place anyway, so that if you do fall ill and it's difficult for you to communicate with, your family or people that are helping you with your care, all this information is in one place. So I would suggest you do that. Make sure you get some help with your medication management. I know, as Congressman stated and Dr. Basta stated, you do have easier access to your prescription meds now, getting more of a level. But it's important that you keep managing those and that you know what you're supposed to take, how often you take it. And so it's really important for you to do that. Some of you aren't used to managing that many meds, and some of you are on a lot of meds. So it's important that you keep track. One of the other things that's really important is socialization. And I know that that's difficult for you right now. Socialization is important. Social distancing doesn't mean isolation. So you do need to be around people that you love, you like spending time with, but you do need to practice things like the social distancing, the masking. That's important. And it's important to wear the mask over your nose and your mouth. The droplets containing the virus can come out of an individual's nose as well as their mouth. So it's important for the masking to take place fully. I have some information here. As you know, Illinois is looking to go into phase 4 on Friday, which is a good thing. We can kind of move into another phase here. Things get relaxed a little bit more as far as what kinds of activities you can do. All outdoor recreation is going to be unlimited. It's okay for you if you feel up to it, if you are able to go out and take a walk, get fresh air, get some sunlight. That's important. Take a mask with you just in case, maybe on the trail you're on or in the area you're walking, you end up getting around a lot of people that you can't social distance. So keep your mask with you. If you get into that situation, go ahead and put your mask on. Retail establishments will all be open. They will have some restrictions as far as the number of people that can be in there. All health care providers will now be open and providing care no matter what it is, whether it's dermatology or anything. They're all going to be open, of course, with some restrictions. So this is a time that's going to allow you to get out and mingle with other people. If you have a lot of health conditions, if you have lung conditions, and cardiovascular conditions, diabetes, if you have a lot of those things, make sure you talk with your doctor and reintroduce yourself in a careful way, and making sure that you take care of yourself. But getting back out and getting back into the community, I know for many of you that are very healthy and have none of those pre-existing conditions, is going to be an important thing. So let me give you just a couple of pieces of information. If you want to get in touch with our department, our website is www.willcountyhealth.com. www.willcountyhealth.org, and that's all spelled out, www.willcountyhealth.org. There are a couple of websites that I would recommend that you visit that have a lot of good information on COVID and other resources, and that's the CDC website, www.cdc.gov. And then, of course, the Illinois Department of Public Health website, which is www.dph.ill. And through those three websites, ours, CDC, and Illinois Department of Public Health, you will be able to get a lot of information. If you prefer to call our agency, you can do that too. We have a hotline for COVID, and that is 815-740-8977. And of course, you can get our phone number for our main line in any of our programs on our website. Also, for those of you in Will County, we do have an agency called Senior Services that provides a lot of great programs for seniors. So I'll give you that number real quick, 815-723-9713. So hang in there, everybody. Things are getting better. We are seeing a higher recovery rate as time goes by. And right now, our recovery rate in this region is about 94%. So that means that 94% of the people that get COVID are recovering. That's wonderful. And then we also are seeing a positivity rate that's decreasing and staying low, which means that the number of people that are being tested, the number of positive tests is going down. So that's another thing. Right now we're at about a 5% positivity rate. It fluctuates between 3, 4, and 5. So that's a good thing as well. So I'm available for questions as well if any of you would like to have specific.
Thank you for your remarks there, Ms. Olenek. I did just have a quick question for you, because I know you mentioned at the beginning of your remarks, the Will County Health Department is unique in that there's a community health center affiliated with it. And I know that a number of community health centers are doing COVID-19 testing. Is the health department's is your community health center a good place for seniors to turn to if they're looking to get tested?
Actually, our health center is not doing testing in the health center itself. We, through a grant from the Illinois Department of Public Health, are going out into the community and going to what we call congregate care sites or congregate settings. So we're going to, nursing homes, we're going to shelters, we're going to just in some areas, we're just going and putting a tent up in the parking lot and doing testing in the community. So we're not doing testing at the health center itself, but we are going out into the community and helping to do that testing.
Okay, great. And is there a place where seniors or anybody else can look to see where you might be offering this testing and how they might access that?
Yes, it is on our website. We have 2 lists on our website. One is for the public, and that's where they would look. It would be the public site, which means anyone can go there. The other list is for the congregate sites, which means that you would have to be like a resident or you'd have to be affiliated with that site. So that would be the www.willcountyhealth.org. If they would click on the coronavirus link there, then that'll open up a whole number of pages that they can find information on COVID-19 as well as these test sites.
Great. That sounds wonderful. Well, Ms. Olenek, thank you again for your remarks and sharing all that information. I did want to make an additional note for everybody who's watching. I know that there may be some continued technical difficulties, but this this video is being recorded, and the session will be available on the Congressman's Facebook page later this afternoon, where it can be watched with none of the interruptions. So apologize for any of those difficulties, but the video will be available later today. With that, I'd like to welcome Mr. Jeff Murphy, an emergency nurse with 19 years of practice experience. Mr. Murphy is the president-elect of the Illinois Emergency Nurses Association, supporting and representing over 1,400 practicing emergency nursing clinicians and leaders from across the state. He's also the vice president of Women's, Children's, and Emergency Services at the University of Chicago Medicine. We'll hear from him about the current picture on COVID-19 treatment and some of the concrete steps you can take to protect yourself and your family. Thanks for being here, Jeff.
Good morning. Thank you, Carl. And thank you, Congressman Lipinski, for inviting me. As Carl said, I am the president-elect of the Illinois Emergency Nurses Association and have had the honor during this pandemic of representing over 1,500 emergency nurses who've been on the front lines of this pandemic across the state. I've also been able to participate in some of that care as a nurse at the University of Chicago Medicine. I'll be fairly brief in my comments in the interest of time, but as we were discussing with our members what they thought it would be most valuable to share with our seniors, there were really two things that came out that I want to share with you. The first is that they wanted to make sure that we recognize the public health leaders and our state leaders on this call and not on this call for their swift action and guidance for the community to the community and healthcare organizations that really did help us to flatten the curve in Illinois. That has allowed most healthcare organizations, if not all across the state, to be able to continue to deliver safe healthcare for patients affected by COVID, as well as patients that have routine, emergent, and urgent healthcare needs. As we begin to move through the phases of recovery, we hope that the public continues to follow those guidelines. And as new guidelines come out, they continue to follow those. I'm sure you'll hear several times today, and we already have, that involve practicing social distancing, wearing face coverings, using good hand hygiene, staying home when you're sick. All of those things are going to continue to help keep yourself as well as the community safe. Emergency nurses across the state have continued to deliver healthcare, and as we kind of design our new normal and continue to do so, there was really one resounding message from our membership that they wanted us to share, and that's that we don't want to see you in our emergency departments. And so this is the time as healthcare organizations continue to open up and start providing non-emergent services for you to call your doctor and ensure that you are continuing to receive ongoing care for chronic health conditions like hypertension and diabetes and heart disease. People can be seen in person with new safety measures that organizations are putting in place, as well as virtually. There has been a tremendous amount of development around telemedicine and virtual health. Many of your visits with your doctor can be done from your home. And for those that do need to come into healthcare organizations, most have taken steps to ensure that we can continue to provide care in a safe space. So that may look different when people arrive to emergency departments or hospitals, and may involve screening at check-in, screening of visitors, screening of staff, temperature checking. But we want the public to know that we are taking all of the steps that we can to ensure that when you're coming for care, we're able to continue to keep you safe.
Great, Jeff. Thank you so much for those remarks. Really appreciate that, and the work that you're doing to keep our folks healthy and help them get well. Next, joining us, we have Miss Vivian Anderson, who is the Chief Deputy and Senate Liaison in Legislative Affairs in the Office of the Illinois Secretary of State. In her role, she keeps Illinois legislators informed about the agency's work and advocates to ensure the agency is well equipped to handle people's needs. She'll be sharing information about the agency's operations and what you can expect when renewing a driver's license or a vehicle sticker. Welcome, Vivian.
Good morning. Thank you and the Congressman for inviting me to participate today. The Secretary of State driver's facilities are open statewide. They opened up back on June 2nd. Chicagoland facilities are open on Tuesdays through Fridays from 7:30 a.m. to 6 p.m. and Saturdays 7:30 a.m. to 2 p.m. Hours of operation for facilities outside of Chicago metro area are Tuesday 8 a.m. to 5:30 p.m., Wednesday through Friday 8 a.m. to 5 p.m., and Saturdays from 7:30 to noon. Through July 31st, the facilities will only serve customers such as new drivers, customers with expired driver's licenses or ID cards, and vehicle transactions such as stickers for their license plate or titles or registrations. However, at this time, we are encouraging seniors to not visit a facility. The Secretary has worked with the governor's office to extend all driver's licenses and license plate sticker renewals through October 1st. They will remain valid through October 1st. If the governor issues another executive order, we will extend that date as well. The facilities, since they've reopened back on June 2nd, are experiencing some long lines. So we want to encourage the seniors to stay home and take advantage of the extension that we're providing. Law enforcement is aware of the extension, and so there wouldn't be any need for, if you were pulled over by a police officer, your sticker they're aware that your sticker is still valid, and if your driver's license is expired, they're aware that it is still valid in the state of Illinois. We've also shared this information regarding the extension with the National Association of DMVs. We've taken some extreme measures in the facilities to keep seniors and our Secretary of State employees safe during this pandemic. All seniors who come into facilities are given priority so that they don't have to wait in line as long as a regular customer. Most of the chairs have been removed from the facilities, but they are made available to seniors who are standing in long lines. Employees wear a face covering, either a mask or a face shield or both. We only allow 25 customers in the facility at one time, and there's a minimum of 6 feet distance required in between customers who may be waiting in line. All customers are required to wear face coverings, and we have hired additional Secretary of State staff solely for cleaning and disinfecting throughout the day. Surfaces that are touched by the customer, such as countertops, signature pads, pens, vision machines, are all cleaned with disinfectant after every use by customers. Every other workstation is in use, which allows more space between customers. And plexiglass has been installed at each work location to further separate customers and employees. Any customer who is uncomfortable with using the vision screen machine can submit a vision specialist report from their personal eye doctor, and there's a form online that you would bring into the facility when you come in to renew. Each employee has their temperature taken at the beginning of their workday and are instructed to go home if they have a temperature greater than 100. For road exams, there are disposable seat covers that are used by the examiner in the vehicles, and the customer may choose to roll down the windows in the vehicle to allow for fresh air to circulate within the vehicle. There is a plethora of information on the Secretary of State's website. It's www.cyberdriveillinois.com, and it's all spelled out, cyberdriveillinois.com. I hope this information is helpful. We are available in the Secretary's legislative office to help with any constituent issues that the Congressman or his staff may have. I'm available to help with any questions that you may have regarding this pandemic and the closures. Thank you.
Thank you so much, Vivian, for that great information. You did mention a piece of information, and I thought it was really important, so I just want to clarify that. You had mentioned that the state is extending the validity of all driver's licenses and vehicle stickers until October 1st. Is that correct?
That's correct, yes.
Great. And I know at the beginning you also mentioned hours of operation for facilities around the state. Is that information available on the website as well?
Yes, it is.
Okay, Wonderful. Thank you. And just one more time, the website is?
It's www.cyberdriveillinois.com.
Great. Well, Vivian, thank you so much for
Thank you.
your remarks and that information.
Thanks for having me.
Great. And lastly, we're going to hear from Dr. Kiran Joshi, Senior Medical Officer with the Cook County Department of Public Health and attending physician with the Department of Family Medicine at Stroger Hospital of Cook County. Dr. Joshi will share updates on Cook County's most recent COVID-19 response initiatives and guidance. Thank you for being here, Dr. Joshi.
Thank you so much, Carl. Good morning, everyone. As Carl mentioned, am a senior medical officer and co-director at the Cook County Department of Public Health. We are the certified public health authority for suburban Cook County. Thank you, Congressman Lipinski, for the opportunity to share some information with your constituents this morning. I'm so pleased to be here with you among such distinguished colleagues. So we've been responding to the COVID-19 pandemic since we first saw it in our state way back in January. We've been working to provide guidance to hospitals and to congregate settings such as long-term care facilities to help them keep patients and residents safe. We've also been doing case investigations and contact tracing to try to understand and curb the spread of the pandemic in our jurisdiction. We have almost 30 CCDPH communicable disease staff members and resident physicians who are conducting case investigations and contact tracing. Tracers will typically gather information from cases on current symptoms, including exposure history, work history, and so forth, and also provide information about when to quarantine and isolate. And this is all towards the goal of minimizing the spread of disease. We've also been putting together surveillance data, and we try to provide the public with more details on how the pandemic is affecting them. We've seen more than 33,000 cases in suburban Cook and over 1,500 deaths. As with national data, our data reinforces the message that older adults need to take particular care at this time. In suburban Cook, people 60 and above account for 46% of all COVID-19 cases, but they make up for 89% of all deaths. So these are very grim numbers. But please keep in mind that most people who contract the virus do recover, and that includes older adults. So as difficult as it may seem, even as the state is beginning to open up and loosen some of its restrictions, we must continue to follow physical distancing guidelines and remain vigilant about minimizing our risk for exposure. So this could mean continuing to minimize the people we're in contact with, even as other people might be expanding their social interactions. Again, I know this is difficult. And on a personal note, I just want you all to know that I live with my parents and I haven't hugged my mom in months. Older adults and anyone with underlying health conditions like diabetes, heart conditions, and lung disease are at higher risk for complications due to COVID-19 infection. And again, we do understand that minimizing contacts can present special challenges for some older adults. For those who rely on adult children or other caregivers to help with errands or household chores, maintaining physical distancing can be really tough. Older adults who may live at home by themselves or in senior developments where visiting is curtailed right now might be missing family and friends. And again, I personally understand that it's really hard not to hug your grandchildren. But I also acknowledge that this kind of social isolation can have a negative impact on your overall health. So it's really important to do what you can to reduce social isolation and connect with friends and family, which can be easier said than done. But many recommendations for ways to connect during the pandemic involve online resources like Zoom meeting with friends or exploring online virtual tours of museums or national parks, just to name a few examples. These are great, but you don't need to be comfortable with technology to engage. You do need to be comfortable with technology to engage that way. And people need to have internet connectivity at home, which we know isn't available to everyone. So in addition to those ideas, keeping mentally and physically engaged can help you to combat feelings of isolation. This could be the time to revisit that instrument you played in your teens, read some great books that you've been putting off, journal, or to write letters. Whatever you choose to do, we urge you to reach out. Participating in meetings like this one is a great way to connect to resources, ideas, and support. As we move toward contact and interaction with others, we encourage you to weigh your risks. There are safer choices like meeting family and friends outside, continuing to maintain physical distance, wearing masks, and hand washing that will allow us to benefit from being with the people we care about without putting ourselves at higher risk for infection. We encourage you and everyone, regardless of age or health condition, to continue protecting yourselves and others by continuing with the practices that we know have helped to flatten the curve. So with that, I will close out my comments and say, if you have questions, please feel free to reach out to us via our COVID-19 hotline, which is available Mondays through Fridays from 9 a.m. to 4 p.m. at 708-633-3319. Again, that's 708-633-3319. We are happy to take your questions. And once again, thank you so much.
Thank you, Dr. Joshi, for those remarks. Now that both you and Ms. Olenek have shared your perspectives on how your counties are managing the pandemic, I did just want to ask, I think for people who are looking at public health guidance, seniors and others, there are a number of resources. There are a number of different agencies that are putting out information. Illinois Department of Public Health, Cook County, Will County, City of Chicago. Are you guys, coordinating pretty well and on the same page? And how would you recommend, seniors and others who want to see that latest guidance, how do they navigate that?
Yeah, so as Ms. Olenek mentioned, IDPH guidance for the next phase has been released. That was just released today. We're digesting it right now. We intend to provide updates on our website. I'd say that's probably the best resource for folks in our jurisdiction. I defer to my colleague for others. I would say we try really hard to keep our website updated and relevant. And I think it's just a great resource for everyone, including seniors.
Sue, we can't hear you there. Are you muted?
If we at local health department level would receive inquiries from the community, or we would have information that we needed from IDPH, we would make that request, and we were getting responses within 48 hours. It's been very good, and the IDPH website is a very, very good resource for up-to-date information.
Great, glad to hear that. Now that you both have shared your thoughts as well, I did want to drill down just a little bit more on testing, because I know that's one of people's top concerns at the moment. Could you each maybe share the best place you think people should be directed to for testing in your jurisdictions?
Sure, if you don't mind, I'll go first. So as I mentioned previously, we do have a listing these sites. They can, you register online. You need an ID, a state issued ID. If you have insurance, we are required to collect that information, although your insurance is not billed. But it's one of those details that the state is trying to gain information on as we go through this process. It's been about 2 days. To do that. As I mentioned, many of the providers in the communities are not doing the testing. One thing I would not recommend doing, you are hearing now about an antigen test that's out there. It's a test that will determine if you have antibodies for COVID-19. I would caution people to not use that at this point. It is not an FDA approved or validated test, so it's unreliable. So I would wait until we have an FDA validated test, and then I would highly recommend, once we have that, for everybody to get tested so that we can determine different levels of immunity in the community.
Thank you so much, Sue. I did notice, sounds like your audio cut out a couple times there. So if it's all right, we'll probably follow up with you afterwards to get some of that information. We can post that on our Facebook page. Oh, no worries. And Dr. Joshi, did you have any perspectives on where to direct folks for testing in Cook County?
Yeah, before I get to that, just regarding the final portion of my colleague's comments, I strongly concur. I think there's been a lot of discussion about antibody testing, which is testing that's purported to sort of provide information about whether one has had COVID-19 previously. And so a couple of issues with that. One, those tests are not, the accuracy of those tests is unclear, one. And two, we're not sure if you have antibodies, what that actually means, whether it means you're actually immune or not. So there's a lot of research, I think, that needs to be done before we can say with certainty how to interpret antibody tests. And that is a question that we get quite frequently, and I thank my colleague for raising that. Regarding testing, it's really a simple answer, and it's here. I think the IDPH website is a really wonderful resource. They have a number. As I'm sure folks may be aware, they operate a number of community-based testing sites throughout the state, including suburban Cook County. So their website lists those locations along with a map of locations where the private sector has stepped up and is doing testing as well. So again, if folks are interested in knowing where to go for testing in suburban Cook County, I highly recommend the sort of map that's on the IDPH website.
Great, thank you, Dr. Joshi. Did also want to note for our viewers, the Congressman's office has produced an infographic on various testing resources available, whether those are free sites being operated by the City of Chicago, how to find testing at a community health center, as well as the IDPH map that Dr. Joshi just mentioned. And we're happy to reshare that infographic. So that's top of the page there. Again, thank you, Dr. Joshi, and all of our panelists for your informative presentations. Your efforts to keep our community's critical services operating and our population healthy, especially the many seniors who have joined us today, are very much appreciated. I'd like to turn it back to Congressman Lipinski for some closing remarks.
Thank you, Carl. Thank you for your job moderating today. But I want to thank all of our panelists for being with us today and spending a little extra time. We've gone a little over an hour here, but the information that you provided for us has been extremely helpful. I think that it's going to be very helpful to all of our seniors out there. This will be available on my Facebook page and for viewing later. So anyone who is watching right now, I know we had some technical difficulties. I apologize for that. But the entire video, well, without interruption, will be available to view later on. So you can get more information on that and on anything else at lipinski.house.gov. That's our office's website. You can find all the information on our offices, how to contact us, and anything that we can do to be helpful to you. We certainly are there to help you out. I know this is a tough time for for everybody, but we're all doing the best we can. Just keep safe and make sure you do those things that we've all learned over the past months about washing your hands and using hand sanitizer. Wear a mask when you are going out, and just stay safe out there. So thank you all for being with us today. Again, thank you to the panelists for everything. And there's a lot more information that we will make available to you that we have there on our website and on the websites of that the panelists mentioned, and all the information that was talked about today by all our panelists. There will be, we will put information up on our website. So thank you all for being with us today, and stay safe out there. Take care.